Pain in your buttocks can be difficult to diagnose. Is it sciatica? Is it your hip joint or labrum? Or is it piriformis syndrome? Chances are, if you've been to your doctor or you've talked to a friend and you've told them you have pain in your buttocks, they're going to tell you it's piriformis syndrome. I mean, that's what pain in the buttocks is. But is it? In this video, I'm going to dive into exactly what piriformis is and isn't, what causes it, and more importantly, I'm going to show you 3 exercises you can do to take away piriformis syndrome pain. So first off, let's talk about what piriformis syndrome is. Piriformis syndrome is an impingement of your sciatic nerve due to hypertrophy, overuse, or inflammation of your piriformis muscle. Now, your piriformis muscle is what's called a deep external rotator. Its job is to turn your leg, your femur bone, outwards. It does the same job as the gluteus maximus muscle, although it's quite a bit smaller. So it can be overused really easily. Because your sciatic nerve starts from your lower back, it's a bunch of nerves from your lower back come down, go through your buttocks region, but it actually passes behind your piriformis muscle. So when your piriformis muscle contracts really strongly or gets too large, it pinches or impinges on the sciatic nerve, causing buttocks pain. That is the theory. And it's been thought that the piriformis gets tight, which is why you see a lot of exercises for piriformis syndrome and stretches. And I'll show you one later today because they can be quite effective. But what a lot of recent research, when they've done ultrasound, basically imaging of the glute region, what they found in patients who have active and painful piriformis area, the piriformis muscle is enlarged or hypertrophied, meaning it's been overused or used too much. Just like if you lift weights, your muscles get bigger. Well, that can happen in your piriformis muscle. But the question is why? Why would a little muscle start getting bigger? One of the theories is that your gluteus maximus, your big butt muscle, that muscle actually is not as active as it should be. And when doing exercises like squats, going up and down stairs, or lunges, the piriformis takes over the job that the gluteus maximus muscle should be doing. That theory is gaining traction, and I'll be showing you a drill later today that can isolate the glute max while deactivating your deep hip rotators. It's going to be very effective at getting the right muscle turned on and allowing your piriformis muscle to not be as active and therefore maybe decrease in size and give your sciatic nerve some room and space. So what are the symptoms of piriformis syndrome? Number 1, of course, is buttocks pain. 2, you get numbness and tingling that goes down the leg, pain down the leg. It's usually often pain when you sit for too long, like if you take a long car ride, and it often feels like you have a rocker ball right in your buttocks. Sure sounds a lot like sciatica, or even sounds like hip arthritis. It can be hard to determine which one is which. So what I'm going to show you now are some ways you can diagnose piriformis syndrome and some ways in which you can diagnose sciatica so you can see the difference between the two and make sure we're addressing the right issues. So one of the tests we can use to diagnose piriformis syndrome, or at least get a test that says a positive result is likely to be piriformis syndrome, is a test called the FAIR test. You're going to be in a side-lying position with your legs bent up to 90 degrees. So this top leg, let's say this is your symptomatic leg, you're going to flex this leg up, you're going to let it fall down or adduct, and then you're going to lift up your foot or internally rotate. And if you experience pain in your buttocks region where you get your piriformis syndrome, then this is considered a positive test. So FAIR stands for flexion, adduction, and internal rotation. Again, that final piece is you're lifting your foot up to the ceiling, and that can cause piriformis pain. So that's the first piriformis test. The next test you can do to determine if you have piriformis syndrome pain is to sit in a chair or on the edge of a bench where your legs are hanging down, so your hip is at 90 degrees, your knees at 90 degrees. You're going to add some compression or resistance to the outside of your legs, and you're going to push out. So you're going to really drive in with your hands and push out this way, And if this external rotation of the hip, if this motion causes buttock pain, you could also have piriformis syndrome. Let's go on to the third test. The third test you can do to help rule in piriformis syndrome is simply a clamshell exercise, where you're in a bent knee position, you're raising up the top legs, you're externally rotating. Again, that's the job of the piriformis. So you're rotating that out, and as you lift up, you're going to be using your buttocks muscle. You should use your glute max in this exercise, but again, if that tissue is inactive, you're going to use your deep external rotator, your piriformis, and that will end up causing deep pain. Not on the surface, not like on your hip bone here, but deep down within the glute. That'll be your pain, the pain you talk about as, I have buttocks pain. That will be a rule in for piriformis syndrome. So those are 3 tests you can do to trigger piriformis pain and know that that may be the root cause of your issue. What about sciatica? How do we know that it's not sciatic nerve pain? Well, first off, some people who have sciatic nerve pain have pain in the lower back and not just in the glute. Again, sciatic issues stem from disc compression of nerve roots in your lower back that then travel down your leg. Another way sciatic nerve issues, sciatica, could be causing buttock pain is when you compress the nerve root in a flexed position. So bending forward at the waist could trigger pain down your leg. That's most likely also sciatica versus piriformis syndrome. Another test you can do is a simple straight leg raise test. This one, it needs to be combined with other tests. By itself, it's not good enough to determine whether it's sciatica versus piriformis pain. But again, piriformis syndrome is diagnosed by ruling everything out, and then you're left with the condition of piriformis syndrome. So that test is called a straight leg raise test. So lying on a table, one leg flat down, you're going to raise your other leg up. You can use a strap, or you can raise it on your own volition. If you experience pain not only in the buttocks, but also pain down the back side of your leg, that can also be sciatica versus piriformis syndrome. All right, so now that we know some tests we can do to trigger the piriformis pain and know that those might be, especially if they're combined together, might be a rule-in mechanism for piriformis syndrome, and we know some sciatic tests to do to determine whether it's sciatica versus piriformis syndrome. Now the question becomes, how do you treat it? Let's say you've done those tests and it does appear that you do have piriformis syndrome. Now I will tell you, piriformis syndrome is only present in 6% of all lower back pain cases, so it probably gets more press than it should. It's probably not as prevalent as we think it is, but let's say those tests did determine that you truly had it. Well, stretching has been shown to help. Deep massage, that's one thing you want to be careful with. If we know the sciatic nerve compression, if the piriformis is enlarged or hypertrophied and it pushes on your sciatic nerve, that causes problems. Deep massage might not be the best thing to do because you're also going to be compressing in on the sciatic nerve, and that can trigger even worse pain. It's a very common finding I find in clients who have come in to my clinic. I'm a specialist physical therapist, and they've been to a deep tissue massage and it's made it worse. So you want to be careful with deep tissue massage, whereas stretching is a light enough drill that it's not going to put too much compression on the sciatic nerve. Another treatment option that has gained traction are Botox injections. Botox, when done under ultrasound to make sure it goes right into the piriformis, helps to release tissue tension in the tissue, and that can alleviate compression from your sciatic nerve. Been shown to be a great symptom relief for piriformis syndrome. The other treatment, again, is to activate your glute max, your big glute muscle, and deactivate your piriformis. So doing drills that isolate your glute max and make it so you're not really bearing down to do a drill so that you activate your piriformis. That's what we don't want. We want the piriformis to not be used as much. And your big glute muscle, which that's its job, is to do big heavy work. We want that to be active. So what I'm going to show you now are 3 exercises you can do to help eliminate or at least decrease piriformis pain The first drill I'm going to show you is a pigeon stretch. Its job is to stretch the deep rotators of the hip. You want to be careful not to put too much weight on the hip initially because that can cause issues. If you feel any tingling, numbness, sharp pain down your leg, stop or try to take some pressure off with your hands. So this is how you do the drill. What you're going to do is you're going to take your affected leg, let's say it's your right, you're going to flex up your hip and bring your foot across your body. So if it's my right leg, my right foot is pointing to the left side of my body. From there, I'm going to sit back onto my hip so I feel a stretch deep within my lateral hip and glute region. What I'm going to do is I'm going to hold that stretch for 1 to 2 minutes to allow these tissues to really relax. You want the superficial tissues, your big glute muscles, to relax so that the deep rotators, like your piriformis, can feel a stretch. Again, hold 1 to 2 minutes in this position. The next drill for treating piriformis syndrome is a quadruped hip extension drill. The goal is to activate your core. Now, in a lot of cases where people have piriformis syndrome, they also have some signs of sciatica or lumbar issues. So playing the odds, we want to make sure we're doing some core drills to help with any lumbar related issue, but we're going to add a hip extension piece to it to activate your big glute max muscle. Again, we don't want to add any external rotation in this drill because if we do, we know we're going to trigger the piriformis and that can cause pain. So you just want to feel it superficially in your big butt muscle. If you feel it deep down in your piriformis, you're pushing too hard and you need to relax and not do as aggressive of a hip extension. So this is how the drill looks. So what you're going to do, you're going to come down into a half plank position. So your knees are on the table, elbows on the table, feet are up. You're going to draw your belly button up towards the ceiling to activate your core. And then you're going to take your affected leg and you're going to drive it up towards the ceiling without arching your back. You want to hold your abdominal muscles tight to stay in a neutral spine position, but you want to keep your knee bent and drive your foot up to the ceiling so you feel your glute activate. You don't want to externally rotate the leg because that can cause issues. And you want to hold that for 30 seconds to a minute. The final drill I'm going to show you is a PRI, or Postural Rehabilitation Institute drill, called a left side lying right glute max. What you're going to do, you're going to lie on your left side. This is it for people who have a right-sided issue. You can also do the similar on the left. You just flip it. What you're going to do is you're going to have your feet flush against the wall, knees bent to 90 degrees. You're going to be lying on your left side, and the first thing you're going to do is you're going to try to lift your torso up off the ground by driving your left hip into the ground. So you'll have a space underneath your torso. That activates your left oblique muscles and also opens up your right QL and lat. So it opens up this area, which is especially helpful if you have any nerve compression. Once you're in that position, you're going to take your top leg and you're going to reach it forward. So it's not rolling your whole body, it's just reaching this top leg forward. Foot stays flat on the ground, abs stay tucked up. What you're then going to do is you're going to rotate this leg out to the side while maintaining the reach from your leg. When you do that, this should light up your big right glute max without activating your piriformis. And you're going to hold this, taking deep breaths in through your nose, blow out through your mouth, and you're going to do 5 deep breaths in this position and do 2 to 3 repetitions. All right, so there you have it. 3 drills you can do to help decrease piriformis syndrome buttocks pain. Hey guys, if you like this video, if you got value from it, I'd love if you hit like, subscribe, hit the notification bell so you get notified when my future videos come out. And until next time, train smarter and perform better.